Well, Dale and Susan, thank you so much for taking some time out of your busy schedules there in Nepal. I know it's morning there, it's evening here. Your day is just getting started. It's amazing to think that you've now been at Scheer Memorial for just over a year. The three of us met your first week there, actually. I was there and you were there, and you were just getting your feet wet, and little did you know what God would be doing through you there at Scheer. But Dale, tell us a little bit about your background and what took you to be the CEO of Scheer Memorial Hospital.
Well, I was a physician in the Navy. I'd spent over 33 years on naval service, and had lived in a number of different countries and provided medical care in some pretty remote and austere environments, including Iraq and Afghanistan. And was sitting in church one day minding my own business when Lowell Cooper came up to me and said, "Hey Dale, what are you doing and with yourself? I heard you retired from the Navy." So I told him I was looking around for something interesting to do, which was probably a mistake or a blessing on my part. I'm not sure which. But he mentioned the post here in Nepal. And it sounded interesting, and Susan and I had talked about doing mission work at some point in our lives, and it seemed the perfect opportunity. Seemed like God was leading us in this direction. We prayed a lot, sold our house in Maryland, put all our stuff in storage, and came over here on a leap of faith.
Wow. Now, what is the mission of Scheer Memorial? I mean, what do you do there in Nepal? Who is your clientele, your patient? What really is your mission?
Well, the mission really hasn't changed much since the hospital first started in 1960 under Dr. Stanley Sturgis, primarily to provide charity care for underprivileged patients. And that's still the main mission of our hospital. We take patients that other hospitals refuse.
Now, I think all the world knows that in May of last year, Nepal suffered just a devastating earthquake and aftershocks. What has that earthquake, or how has that earthquake affected the ministry of Scheer Memorial?
Well, in a number of ways, again, there was tragic loss of life for an already impoverished country. It set Nepal, I think, back a decade. It certainly focused for a few weeks the spotlight of the world on Nepal and the many challenges we face. But in many ways, that crisis is still ongoing. There has not been much in the way of government help, government reconstruction. Except in the urban areas. Out in the countryside where there was a lot of devastation, especially up in a district called Sindupalchok, things really haven't changed too much. People are displaced from their homes. Upwards of 80,000 families are living in tents or in barns, with their cattle. And what we have seen here at Scheer, in addition to the initial injuries related to the earthquake, is a big increase in worsening of chronic disease and other infectious disease that's caused by living in close proximity to animals. So it's a continuing struggle that's actually been made worse by the little reported events that have been happening over the past 4 months on the Nepal-Indian border, where there's been essentially a blockade, and that's affected the supplies of fuel, cooking gas, medical supplies, transportation throughout Nepal.
Now, Global Health Initiatives, an organization that partners with both of us and links us together, recently told us about a emergency mobile clinic that Scheer Memorial is looking to begin using to take healthcare to the most devastated areas from that earthquake. Can you speak a little bit to that mobile clinic?
Yes, this was another opportunity provided through our partnership with Centura Health International, and they've been a strong supporter. The people in the Denver area in Colorado have really been amazing. The amount of support they have provided to Scheer Memorial Hospital over the years. This particular program, there's an organization called Women for Women that's out of the Netherlands, and after the earthquake, they were able to raise some money to buy a mobile health clinic, because up to 90% of the clinics in health clinics in 14 districts that were affected by the earthquake here in Nepal were destroyed or damaged in such a way that they could no longer function. So the need to provide care in the rural areas is very great. The thought is we will use this mobile health clinic to go out in those areas within 200 kilometers of the hospital and provide care where none is currently available.
Wow. What kind of impact do you see that making, Dale? What kind of things do you think you'd be treating through that mobile clinic?
Well, the focus of the clinic is going to be primarily women and children under 5 years of age, because those are the disadvantaged members of society here in Nepal. But we will be taking care of anybody who shows up to the clinic. We will have laboratory capability. We'll have some medical imaging capability with ultrasound. The other thing we want to do is Scheer Memorial Hospital is still the only Adventist healthcare facility in the entire country. And we've been here for over 55 years. So our goal is to expand Adventist healthcare in Nepal and to be able to show God's love through a mission of service. So that's really our goal. And I think, hopefully we'll have a significant impact out in the countryside.
Well, at Newday, we take our celebration of Christmas pretty seriously, and we believe that in the way we celebrate Christmas, we can still change the world. And so we spend a little bit less every Christmas so that we can give a little bit more. We collect a Christmas offering so that we can find organizations who are doing things around the world that kind of align with why Jesus came in the first place. And Global Health Initiatives came to us with your idea for the emergency medical clinic, and they said it would cost about $1,000 a month to fund that ministry to the people of Nepal, the women and the children particularly, and asked us to donate $12,000 for the first year of operation. And thanks to the generosity of the folks at our church who heard about what you're doing there and wanted to contribute, we're happy to present Global Health Initiatives with a check for $12,200 to fund that ministry in that clinic once it arrives in Nepal. And we just want to say thank you to you for the sacrifice that you're making there, for the way that you're serving the people of Nepal so well, and for the plans that you have to reach the least of these in the outlying regions outside of Banipa.
Yeah, well, I just want to say thank you so much to you and your members there for their generosity and their concern for those less fortunate around the world. I mean, it's only through the support of people like you that we are still able to function here. And the really amazing thing about Nepal is how far a little money goes here. So this donation will have a significant impact here in Nepal, and I will make sure that I report back to you and your members progress with regards to this mobile health clinic and the impact that it will make out in the countryside. So again, thank you very much.